also currently recording this mini workshop for you para you can view it later or later this week sa YouTube. So, let's now start, no? So what are our objectives or ang aton nga set up for our mini workshop? So, firstly, of course, I'm going to introduce the concepts of how to write a psych report, and of course, what are the objectives of this workshop. Then, of course, I'm going to discuss how to write a psych evaluation report in different models. Okay, so there are different ways in which you can write a psych report, and I'm going to introduce that sa inyo. Of course, Dion, I will give you some additional tips and tricks on how to do your psych report. And of course, questions and clarifications. So, sa tips and tricks, daw, dara ko gid pakita sa inyo kung some tips on how to write your psych report, at the same time, how to somehow analyze mga test results, okay? So, next. So, writing a psych evaluation report may be overwhelming to a beginner, but what I have learned from my experience is that writing a psychological report is like assembling a puzzle. You integrate various data from different evaluation techniques and forming a picture of a person. Writing a psych evaluation report is both an art, wherein you develop your own style of writing, and a science, wherein you write with objectivity and accountability in generating conclusions and making the decisions about an individual. Okay, so, amo na nga akong nga description on how to write a psych report. It's like assembling a puzzle. So, diba, what we have learned in our previous nga mga lessons about different assessment methods, diba? So, not only that we are trying to somehow solve a problem or try to answer a question, a referral question, but we also try to gather data from different sources, diba? From our interviews, from our psychological tests, from our behavioral observations. So, those three modes on how we can gather data, we try to integrate them and try to form a picture of our client. Okay, so we are trying to view them as a whole, the holistic siya gani. So, it's also both an art and a science. So, I am aware that we have different writing styles, no? So, it's an art because you can develop your own writing style on how to write a psych report. And at the same time, it's a science because we are objective. Okay? We're trying to answer a referral question gani. So, it's both art and science. Tandaan nyo din na. Okay, so let's now have our objectives. So, objective number 1, so we try to understand and, of course, appreciate the multi-method approach in assessment. Okay, and then objective number 2, understand and appreciate the significance of psychological evaluation reports. Objective number 3, identify different models adapted in psychological report writing. Objective number 4, familiarize oneself with the important sections of the psychological report format. Number 5, learn how to write certain segments of the psych report. So those are our objectives of this session. Okay, so let's now begin our workshop. Okay, so just a mini lecture on the different models of psych evaluation report writing. And then after that, I'm going to demonstrate on how you can write your psych report. Give you samples also. Ayan. So, of course, what our review? Balikan nyo gini ha. Basta na mag-go naman sa exam o kung sa board exam ninyo. So, like, what are the purposes of and goals of assessment? Of course, to classify, to describe, and to predict behavior. And purposes, okay, there are many purposes depending on the referral question, but some of them are for screening, problem solving, diagnosis, counseling and rehabilitation, and of course, progress evaluations. Okay, so excuse me. So please remember those goals and purposes of assessment. So, what is the multi-method approach to assessment? So, of course, in the multi-method approach, it is like we are gathering, the data gathering method is multi-method. There are different ways in which we can gather data in order to um, write a psych report. So like I said, no? So we gather data from interviews. So either it's a case history, okay, intake interview, which is what I do sa inyo sang or what you did last week, 'di ba, sa inyong friends or family members. So mental status interview, it's also kind of the same with the uh, intake interview. Okay, so behavioral observations, so either through formal using a behavioral checklist. Okay, so like your MSE nga naka-checklist form, okay? Or informal, so you observe people in a naturalistic setting. Okay? And also tests. So I've given you test batteries, right? So like test batteries like intelligence test, personality test, and of course interest and somehow clinical tests. Okay, and of course we also have the other assessment procedures. So it could be physiological tests. So if you have already read your book on the neuropsychological testing, so we have physiological methods on how to measure, like for example, your blood pressure, your fMRI, your MRI, okay, PET scan, anything that is involving biology and also involving the brain. So like that's physiological tests. So your grades are also could be a source of data, right? So your teacher's report and etc. So those are other assessment procedures. So when you review for your exam, of course, always think of the different ways we can gather data, the multi-method approach to assessment. So not only we do interviews, behavioral observation tests, there are also other assessment procedures. So depending on the purpose and of course the referral question. So why is there a need for psych evaluation report? So a evaluation report is the end product of assessment, representing the clinician's effort to integrate assessment data with the functional whole, and they can be used by the client in solving problems and making decisions. So this is the definition by Groth and Marnat in 2003. So if you remember your psych assessment report process, okay, so after we have know the referral question, after we have conducted the intake interview, after we have selected test and administered the test to the clients, after we have analyzed and integrate the data, we try to communicate our psychological evaluation. We try to communicate the results through the psychological evaluation report. Okay, so that's what the end product is. So it is used to, of course, integrate data and, of course, to answer questions, to solve problems, and also to make decisions. So in making decisions, like for example, if the purpose is for employment, for recruitment, so the psych evaluation report can help guide the hiring manager as to whom to select the best candidate for the job. Okay, so just remember that in psych assessment, it also overlaps with different industries like IO, like clinical, like educational. So you really need to be familiar at least with what are the purposes of the psych assessment. Okay? So it is also a principal vehicle of communication, a medium through which findings are described and impressions are conveyed as clearly as concisely as possible. Okay, so we also know that at the end of the psych assessment process, we are not only to create a psych evaluation report, but we also try to communicate it to the referral person. Okay? So a psych evaluation report also involves analyzing, synthesizing, and integrating numerous sources of data, including, of course, present and previous test scores, the teacher's report, the behavioral observations, the interview, the social and family history, and of course, medical findings. If you can see, I mentioned before the multi-method approach in assessment. Okay, so of course, this different sources of data, we try to gather and integrate them, okay, into one cohesive psychological report. So what is the purpose of psych evaluation report? So firstly, to describe the client who is being assessed and the client's problem. Okay? If you remember again the goals, describe, predict, and explain behavior, right? So to describe the client, okay, who is the client, who is our client, and of course, what are the presenting issues or what is the client's problem. Okay, so also the psych report can provide a record of evaluation results for future use. Okay, so your psych report that you will make, okay, this could be used, okay, when you, as a reference, maybe when you go to your masteral and then you make again a psychological report. At least you have a record of your previous results, right? So this is also serve as a means of communication to persons wanting or needing the results. Okay, so it's like the previous definition said, it's a vehicle for communication. So this would help us help the clients, and also the referral person understand who the client is and also what are the client's needs, okay, and also help them to create, for example, a a therapy or a solution or intervention to the client's problem. And of course, recommend appropriate courses of action. So the psych report, like I said in here, there is no pass or fail. Okay, so don't confuse yourself that you need to pass a psychological report or psychological assessment or neuropsych assessment. So there's always that misconception that you need to pass the psych report. You need to, you need to pass the psychological assessment, okay? Or fail, or there is a possibility that you will fail a psychological assessment. That's why, for example, people will tell you that, do you have a answer key to the psych assessment or neuropsych assessment, or do you have any reviewer? So that's the common misconception. So you do not need to give them hints for those if you would become psychometrician someday. So you don't need to give them hints or give them reviewers on what to do on the psych assessment report, a psych assessment a session. Okay, so because we are evaluating the client's performance as in the present, and we do not want that there are any biases or any errors in our measurement. Okay, so that's why at least in the fourth purpose of psych evaluation reports, to recommend appropriate courses of action. So if, for example, the client, we knew that the client has a certain learning disability, so we can recommend them to a specialist in learning disabilities, and somehow that specialist can come up with a curriculum that would help the client in adjusting or in learning or overcoming his specific learning disability. Okay? So, what are the different models of psych reports? Okay, so this is by Weiner and Costares. Okay? So, there are three. Okay, so the first one is the test-oriented model. So, results are discussed on a test-to-test basis. Then we have the domain-oriented model. So results are grouped according to certain topics. For example, intellectual ability, interpersonal skills, psychosocial stressors, coping techniques, interpersonal needs, and motivational factors. And of course, the hypothesis testing model. So the results are focused on the possible answers to the referral question. So in test-oriented model, so you're just writing down the results and then you describe the results per test. So that's test-oriented model. So for example, if you have 5 psychological tests there and 2 of them are intelligence tests, so you're just simply reporting what are the scores and also the interpretation per test. And it's you do not try to mix and match or integrate them. In domain-oriented models, so there are different domains that or topics of the person's well-being that you are looking into. So like there is a section for intellectual ability and then there's a section for psychosocial abilities. So if for example, if you have 5 tests and 2 of them are intelligence tests, so you try to compare and contrast the results of the 2 intelligence tests. You try to really describe the intelligence of the client as a whole, and at the same time in the psychosocial abilities. Okay, so you try to discuss what are the client's self-image, what is the client's coping strategies. Okay, so or interpersonal qualities. Okay, so there are domains that you try to describe and you try to integrate the different results of the tests in per domain. Okay, so next is hypothesis testing model. So results are focused on the possible answers to the referral question. So in the hypothesis testing models, the primary purpose is to, of course, answer the referral question. So if the test results are integrated, okay, and we try to look into the specific areas in the psych assessment report that would answer the psych test. So in the difference between domain-oriented and hypothesis testing model is that in domain-oriented, the psych report could be very long because of the different domains that you need to consider. Okay, you need to integrate. But in the hypothesis testing model, you are just looking into the qualities or parts of the psych report that would answer the referral question. Okay, so in college and in grad school, what the psych report that I did was more on the domain-oriented model. But when I had my OGT in a hospital, so we used the hypothesis testing model more. Okay? So, but in a way, they're both, in a way, the modern way of doing it is, it's more of a mix of all these models. So, but it's more focused really on what is the purpose of the assessment rather than the models that you would use. Okay? I hope you're still following me. Okay, so what is the test-oriented model? So results, like I said, are discussed on a test-to-test basis. So each test is listed by name and significant results for the tests are discussed in a test-by-test basis. Each test is listed by name and significant results for the test are presented. There is little or no effort made to contrast data between the two tests. The tests are presented only. There is little or no effort is made to... Okay, lewat lang siya, guys. So, there is little to no effort to be made to contrast and compare and contrast data between various tests. So, this one, so, like I said, so there is only results, and the discussion section is just simply stating the score and the interpretation of it per test. So you do not try to integrate the data from the behavioral observations and also the intake interview. So you're just simply writing the results. So it's less commonly used now, the test-oriented model, because we know that certain tests may have weaknesses in it, and we cannot somehow cover the weaknesses of the test if we aren't able to integrate or compare different test results and also the behavioral observations and interviews. So we cannot really see the whole picture of the client if we are only just focused on the results per test. So the source of each piece of the data is identified, which could be important in forensic assessment settings. So weaknesses, the reader's attentions become focused on the test rather than on the client's adaptive functioning. There's also limited perspective regarding psychological assessment, presenting it to be a low-level technical skill which involve little more than giving the test and copying some interpretative statements out of the manual. So, sometimes our clients or the referral person really has a tendency to just look at the test results only. So, if you use the test-oriented model, the weaknesses of it is that you aren't able to somehow integrate what you have observed in the behavioral observation at the same time intake interview. So you have no way of triangulating or confirming whether your test results are consistent with what you have observed and also what you have interviewed in. So that's the weakness really of the test-oriented model. But the strength of it is at least you can see the test results, okay, per test. Okay, so, and it's important in forensic assessment settings. So, another weakness, so ignores the role of the psychologist as that integrator of data and extensively used in the past that has become increasingly unpopular in the recent years. So, that's the weakness of the test-oriented model. So, for the domain-oriented model, so results are grouped according to certain topics, like I said, by intellectual ability or functioning, then the psychosocial functioning, so that includes interpersonal skills, the psychosocial stressors, coping, interpersonal needs, motivational factors, etc. So, this is useful when there is no specific referral question and there is uncertainty on how the data will be utilized. Okay, so like you can always use the domain-oriented model if, for example, the client wants to know his strengths or weaknesses. Okay, so if it's a self-referral, that could be, and there is no specific referral question, that could be a good model to use. Okay. So, you can always use the domain-oriented model when you do your psych report, since this is just for educational purposes, and this is just for you to get to know yourself better. So, you can always use the domain-oriented model. So, it is, this is common in neuropsychological report where a variety of providers may eventually become involved. So each provider focusing on separate parts of the report to assist on a specific aspect of intervention. So, because in the domain-oriented approach, in the neuropsych assessment or neuropsych reports, so they are looking into the different aspects of the adaptive functioning of the client. So, not only in the intellectual functioning, but also in the psychosocial functioning. So, they can look into somehow if the problem is maybe on the motivational or in the coping techniques. So at least in domain oriented model, it is clearly stated there that in this aspect, this is the coping results, and somehow based on how we integrated the data from the behavioral observation and the interview, we can somehow get a clear picture of the coping strategies or coping needs or techniques of the client. Okay. So strength, helpful in monitoring treatment progress, allows one to monitor changes in the client's functioning across a wide variety of areas. Since in the domain-oriented approach, it is very broad and you have no specific question that you can that you need to answer. So you have somehow a broad and broad scope of the picture of the client. The weakness, however, is that the reader may be presented with a lot of information that has little relevance to his intended intervention, because in domain-oriented approach, you go to it by topic, but in the hypothesis testing model, like I said earlier, you are just going to answer the referral question, and if those domains don't answer the referral question in the hypothesis testing model, you do not need to integrate them in the psych report. Okay. So now let's go to the hypothesis testing model. So results are focused on possible answers to the referral question. So there is a presenting a hypothesis in the purpose for evaluation section and present data systematically to support or refute the hypothesis. So in hypothesis testing model, there is really a referral question that you need to answer, and you are just specifically trying to answer that question. So separate paragraphs in the result of evaluation section address theoretical or conceptual issues by integrating data from history, mental status exam, and behavioral observations with data from all the tests. And also tests are rarely mentioned by name. So you are really just integrating the test results, and also you are just trying to answer the referral question, and there is no need for the test for the psychometrician to like name the test really. Okay, so you just simply trying to tell that okay, this is the overall intellectual functioning of the client. Okay, so strengths, efficiency, and concise, focus on the referral problem, so the reader may not be distracted by unrelated details. So it's very concise. It's very short compared to a domain-oriented model. So usually in a hypothesis testing model, the psych report is usually 3 to 5 pages long. But for a domain-oriented model, it's usually 5 to 10 pages or even more, depending on how many tests you have given to the client, and at the same time, what domains are you going to discuss. So the weakness for hypothesis testing model is that some information which are not related to the purpose of the evaluation are unreported, but which could potentially be useful at some point. So that's only the weakness of the hypothesis testing model, is that we only focused on the domains that answer the referral question, compared to the domain-oriented, wherein you really lay out every domain, or every domain that you can think of. So now let's go into how do we do the psych report format, or what are the parts of the psych report. So of course, the psychological report format, it involves of course the identifying data. So those are that this contains the information about our client, okay, who the referral person is, what is the referral what are their address, their real name, their age, okay? So this part is really confidential, okay? So also the next section is the reason for referral or purpose of evaluation. So we put there what is the purpose for. Is it for screening? Is it for diagnosis? Is it for educational purposes? Or if there is a question that we need to answer, we put there in the reason for referral. Then the background information. So if you remember your intake interview report, so you will try to integrate the family history, the social history, the medical history of the client in the background information. So that's why I let you put I required you to attach required you to get your intake interview report from your classmates. So because you're going to put them in the background information. So evaluation procedures, you list there the different tests that you have conducted. So far we have 6 tests, right? So 1 intelligence test and 5 personality / interest and also clinical test. Okay, so next is the behavioral observation. So in the behavioral observations, you're gonna describe the client's behavior during the interview, during the test, okay? And you can also describe them before the interview and also after the interview and the testing session. So you write it down in descriptive or in behavioral terms. So that's why I also gave you the checklist so that you can just check whether or not the client has those traits, and at the same time so that you can verbally say those observations. So next is test results and interpretation. So the first part of the test results and interpretation is of course the test results. So we're gonna lay out what are the different test results of the client. So whether bar graphs, okay, or the scores, you need to put it there. So remember, I told you to screenshot the test results because you need that in the test results portion, okay? And then after you have laid out every test results there, you need to interpret it. So the interpretation section depends whether your model is hypothesis testing model or domain-oriented model. So those are the 2 models that we're going to use. You can choose whether to do a hypothesis testing model or a domain-oriented model. So what I recommend is the hypothesis testing model because it's only short and concise, and at the same time it answers the referral question. Okay. But if you want a challenge, or you can do a domain-oriented approach. Okay, so I'm going to show to you the hypothesis testing model and the domain-oriented model samples. A summary, then sa summary, so you're gonna summarize the test results. Okay, so what are the significant test results that would answer the behavioral observation, the referral question. Okay, so in the summary, you need to answer the referral question already. So, what are those significant results that you have written? Okay, or what are those outstanding behaviors or test results, and also from your intake interview and your behavioral observation. So, what are those traits, or what are those results? Okay, so next is recommendation. So after you have answered the referral question and the summary, you need to somehow recommend course of action for the client. So for example, if it's for educational purposes, so or for the client, for example, to get to himself or herself better. So if you have certain findings that they need to seek help or therapy, so you need to put it there. And we need to use SMART. Okay, SMART means when you write your recommendation, you need to use SMART. So SMART means specific, measurable, attainable, realistic, and time bound. So we also have another technique called CLEAR. So later on, I will discuss what's the CLEAR method in making recommendations. So, like I said, for the identifying or personal data, this contains the information identifying information of the client, also contains the referral person and the purpose of assessment. So don't forget, we only give the psych assessment results to the referral person. Next is the also it must remain confidential. So as much as possible, we do not divulge the names of our client, and at the same time anything that would identify them. Okay, so when we try to communicate it to someone whom is not authorized. Okay, so reason for referral or purpose of assessment. So even in the presenting problem is seldom the real problem. It is the best starting point. So if there is no referral question that is given by the referral person, so you can always look into your intake interview report and look into the presenting problem of the client. That could be the referral question. So that's why in your intake interview report, you need to in your psych interview report or intake interview report, you need to wait lang din, ha? So in your psych hello. Bati ang ko, no? Ay, la. Nadula ang camera. Okay, okay. Amo lang tong ang wala ni nakita, no? Ang bag-o lang gid. Bati ang tax class. Oo, bag-o lang gid, no? Wala lang gid, sorry gid. Okay. Okay na? Ayan. So, ganyan pa to.
Medyo nag-iba lang naman ang boses sa microphone.
Nag-iba ang boses ko. Okay, thank you. Okay na? Mic test. Okay na po?
Robotic yapon mo.
Robotic yapon. Okay. Okay. Pause natin. So, di na ta gani. Okay, so second point, right? So, if, like I said, if there is no presenting or referral question that is specific, you can always go back to your intake interview report and go to the presenting problem. So that's why, like I said, you really need to write down the presenting problem or at least write a sentence about the presenting problem of the client so that you may somehow have something to put in your referral question. Okay? So, it also states the reason for coming for assessment, why the client has been referred for psychological evaluation. So, what are the initial impressions made by the one who referred? Okay, so you can always get answers to that referral. What is the referral question from the referral person? Okay, so there are also many questions that appear at the start to help the flow of the communication, but the interviewer has to establish control over the interview situation and clarify problems raised. Okay, so that's why in your intake interview, the question that you need to really ask your client is, okay, uh, ho- why did you come to the psychological clinic, or why did you come for assessment? So that's a good question that you can ask your client. Okay, so but if there is no really there's no really specific question, you can always try to get it from the presenting problem. Okay, so background information contains the important background information related to the referral question. So other information from sources, so this could be from the guardian, spouse, or teachers, and presenting issues and past psychological assessment, if any. So in the background information, in your intake interview report, this contains the family history, the social history, the medical history of the client, of course, if there is any legal history there. Okay, you can also include the data that you have that you got from the guardians, okay, the spouse or teacher. That's why when I did my OJT, when we do intake interview, we not only interview the client, we also interview the guardian of the client, okay, so that we can somehow triangulate the data and confirm whether the client's statements are consistent. Okay, so yun. Okay, so that contains also the presenting issues and also the past assessment. Okay, if they have they have done past assessment before. So in test evaluation procedure, so list of all procedures undertaken as well as the psychological test conducted. So you're going to put in there, of course, your intake interview, your MSE, your mini mental state exam, okay, as well as your intake interview, and at the same time the psychological tests that you have conducted. Okay, and as well as if you have other modes or other psych assessment data gathering methods that you have done. So behavioral observation, of course, you're gonna list there the physical appearance of the client, the mannerisms, the particular traits, the reactions, okay, to interview and test situations. So this will be included in that section. There is also special attention given to the style of dealing with the task and emotional quality of the client's behavior and communication patterns. So, particular attention may be given to the clarity of self-expression and level of self-knowledge, willingness to cooperate, openness, and defenses used in the interview. The usefulness of these early impressions will often become apparent in the final stages of evaluation, particularly for diagnosis. So, what we have practiced before in your behavioral observation, you can always refer to the JOY mat. Okay? So, J means judgment or insight. O means the orientation times 3. Okay? I means intellectual functioning. Okay? M means mannerisms or mood or affect. A means M means mood, A means affect, and T means the thought content. Okay, so you can always refer to that. So the behavioral observations must be described using the using behavioral format, behavioral terms. Okay. So test results and interpretation. So in the test results, this contain the score and test interpretation. So the test interpretation, your basis for that is the test manual. So the format may vary from tables or graphs to usually present the results. So depending on what test, okay, so like I said, I told you last week to screenshot. So there are some test results that are in a graph form, okay? So at least you can somehow crop them and then you just paste it in your psych evaluation report. So interpretation, this section where you integrate all data and information concerning the client, comparing and complementing every test administered, behavioral observation, and interview. So keep in mind that in this section, you must include all relevant information results that will answer your referral question. The writer has liberties in what to model to adopt. Your personality result matrix may come handy here. So later on, okay, when we do our psych report writing, the demonstration, so I'm going to teach you on how to use the personality result matrix. Okay, so that you can have a guide on how to integrate the data. So in summary, but in the interpretation, I forgot. You really need to integrate here the behavioral observation and the intake interview report. So you really need to compare and contrast not only the psychological test result, but also what you have observed and also what you have gathered from the interviews. So in summary, okay, so you list the main findings. Okay, so in the main findings that those are the test results that have outstanding data. Okay, so significant data that will answer, okay, that answers the referral question. So having the original purpose of the evaluation in mind, it is essential to summarize the whole report in more than 2 paragraphs. So usually in the summary section, we only put there the main findings in the intellectual functioning and the main findings in the psychosocial functioning. So, and like I said, the most important thing that you need to do in the summary section is to answer the referral question, or to at least answer the presenting issues that you have gathered from your client. So recommendations. So these are therapeutic goals and modes of therapy that are to be suggested. So since you're not yet exposed to the counseling and therapy portion, okay, so just simply you can generically just say that they need professional help, something like that, or you can recommend them to another specialist, something like that, since you're not yet exposed to the different modes of therapy. So maybe when you become when you go to your 4th year, or when you finish your masteral, maybe you can put there the different therapies that you can suggest. Okay, so but like I said, you can only put generic statements, like you can recommend them to go to a specialist, something like that. Okay, interventions and activities that may help the client in the different aspect of his or her life, given the client's present internal and external resources. So in the interventions and activities, of course, you need to use the SMART SMART method. So try to be specific, give them measurable interventions and activities, specific, attainable, realistic, and time bound. Okay, so looking at the client from the holistic perspective, i.e. including the physical, intellectual, social, emotional, and moral or spiritual aspects, may guide in formulating this section. So since in the recommendation sections, you already beforehand, you have already paint a picture of the client. So if you have done that, if you have paint a picture of the client already in the summary, in the test results, so in the recommendations, you are able to at least point out what are some things that are lacking with the client, okay, that you can recommend them so that they can be empowered with their strengths, okay. So they can improve on their stance and at the same time be able to cope with their weaknesses. Okay? So those are the main sections of the psych evaluation report. So here are some tips and tricks. Okay, so in psych report writing. So what is the clear approach in psych report writing? So I have mentioned the SMART method, right? So in the SMART method, this is just the way on how you structure your recommendations. But in the clear approach, this is more of the holistic approach one. A more general way of making recommendations. In the SMART approach is more on the structure of your sentences. Okay, so clear method first is client-centered perspective. This is emphasis is placed on the individualized rather than generic description of the client's abilities and less on score and numbers. Information is organized by theme rather by test by test. Okay, so when you do when you do recommendations, try to look into the client. Okay? Look into the client as a whole. Okay, so rather than the tests results, rather than just the behavioral observations, try to look at them holistically. Next is link referral questions, assessment, results, and recommendations. So, like I said, we are integrating the data. Okay, so when we integrate the data, we not only try to compare and contrast to them, but we always go back. We always go back to them when trying to answer the referral question. We try to link it. We try to check if it's consistent with our test results. Okay, so when we do recommendations, you always go back to the referral questions. What are things that you can recommend that would answer, or if, for example, if you have already answered the referral question in the summary, okay, the recommendation section should be what to do next. Okay, what to do next now that you have answered the referral question. Okay, so you need to link the referral question, the results, and of course the recommendations. So information pertaining to the referral question, results, recommendations is explicitly linked so the reader is better informed about the purpose, results, and outcomes of the assessment. So next is E, enable the reader with concrete recommendations. So a smaller number of concrete, realistic, and implementable recommendations are preferred over a large number of vague suggestions. So like I said, when you structure your recommendation, try to use SMART. Okay? So SMART means specific, measurable, meaningful, attainable, realistic, and timely. Okay? So that you can ensure that the recommendations are easily implemented. So there is also the use of the SMART approach. Okay? So the use of SMART approach can ensure that recommendations are easily implemented. So A means address strengths as well as weaknesses. Okay, so when you do your summary, okay, so try to have a balance. Okay, a psych report provides a balance of descriptions of strengths and weaknesses and is better received by stakeholders and provides rich information pertaining to the specific and overall abilities of the client. So you use sandwich method here. Okay, so the suggestion is use sandwich method. So when you do sandwich method, you describe first the strengths of the client and then weaknesses and then back it up again with the strengths of the client. So that's how we do the psych report. So it's not, we only not not state the strengths only of the client, but we also need to state their weaknesses as well. Okay? And R means readability, ensuring that the reports are written at a level easily understood by most readers. So the recommended level is of course grade 12 level. So if usually the referral person are also professionals, right? Unless that it is self-referral. So the the minimum reading level, okay, should be grade 12. So I already told you right in the task development why is it important that the reading level is on par with the clients or task takers reading level. So it's also kind of the same with writing psych report. So we need to at least make the reader or the referral person understand what we are trying to convey in that psych report. Okay? So at least grade 12 will ensure that readers comprehend the information in the report and are better able to implement suggested recommendations. Okay? So don't be vague in writing your recommendation, and at the same time try to write it clearly and at least readable. Okay? So now before I proceed to the psych report demonstration, so do you have any questions on my mini lecture? Time check.
Ma'am,
Yes,
excuse
Miss
me.
Tao. Yes.
Sa report sa last meeting pala, kailangan pa po
Mm.
ng summary or hindi na?
Summary sang.
Sa interview report, ma'am, last week, sa activity last week.
Ang i-pass nyo, 'di ba? Do you mean ang i-pass nyo or ang inyo nga own?
Ang i-pass po.
Ang sa i-pass nyo, syempre, ang i-pass nyo, 'di ba, ang intake interview report gid mismo. Kung ano tong formats ang intake interview report, amo na siyang i-pass ninyo.
Okay, nothing.
Pero sa own yung psych assessment report, ang project yung gid bala. So, may ara na siya yung summary. Okay? Sige. Any more questions sa inyong sa mini lecture ko? Okay? Wala naman. Or excited na ka mo Sige, so dali lang yun. So, I'll give only 5-minute break. 5-minute break ta anay. Balik lang ta siguro mga 9:40. I'm going to prepare the materials danay while waiting for oo, I'm going to prepare the materials danay para at least when I demonstrate sa inyo smooth na ta. So CR anay kamo. By the way, ang references don't worry class i-publish ko man yung references ninyo. Alright, so thank you. So thanks kay sa psych assessment teacher ko dati, sa akon man nga psych assessment teacher sang grad school, and at the same time ang experience ko sa OJT, mga OJT supervisors ko. So yeah, thank you, and aring references if you want to. Okay. So don't worry, I'll post this naman sa inyong module. So yeah, break lang tayo, balik lang tayo 4. Okay. Wait lang.